Check your state laws and facility policy to make sure you are permitted to perform this procedure. Before helping the person to the commode, check the care plan or the nurse's instructions. Note any restrictions or special considerations. Before you begin, practice hand hygiene, identify the patient, and make sure that privacy has been provided. Follow all additional instructions in the preparation section of this program.
Good morning. My name is Angela. I'll be your nurse assistant today. I just need to check your armband. Can you please tell me your name and date of birth?
3248.
You call for the bathroom. I'm going to assist you today to the bedside commode.
Before helping the person to the commode, practice hand hygiene and put on gloves. Make sure the commode is next to the bed. If the bed rail near you is up, lower it. Help the person sit on the side of the bed.
And you have on non-skid slippers. That's great. I'll help you with your...
Help the person put on a robe and assist the person with putting on non-skid footwear if he is not already wearing it. Then apply a transfer belt. Now assist the person to the commode using the transfer belt as shown in the video skill transferring the person to a chair or wheelchair. Once the person is seated, remove the transfer belt and cover the person with a bath blanket for warmth. Place the toilet tissue and call light within his reach and ask him to signal when he is done or needs help.
Here's your call button, and I'll bring this closer. If you need anything, just use your call button.
Remove and discard your gloves and practice hand hygiene. As you leave the room, close the door. If you must stay with the person, be respectful and provide as much privacy as possible. Return to the room when the person signals, or every 5 minutes to check on the person, and always knock before entering. When you return, practice hand hygiene and put on gloves. As needed, help the person clean the genital area. If the patient has not already discarded hand wipes, be sure to do so. Then remove and discard your gloves and practice hand hygiene again. Put on clean gloves. Now reapply the transfer belt and use it to help the person back to bed. Then remove the transfer belt, robe, and footwear. Raise the bed rail if used. Remove and cover the commode container and take it to the bathroom to observe the color, amount, and character of the urine and feces. Then empty the contents into the toilet and flush. To continue, rinse the container. Pour the rinse water into the toilet and flush again. Also, clean and disinfect the container. Next, return the container to the commode. Close the lid of the commode and clean other parts of it if needed. Then remove your gloves, practice hand hygiene, and return the supplies to their proper place. When you've put on clean gloves, confirm with the person that he has cleaned his hands.
Were you able to clean your hands okay?
Yes, I did.
If necessary, assist the person with hand hygiene. If the person does need assistance, put on clean gloves. After you have assisted with hand hygiene, remove and discard your gloves and practice hand hygiene again. After helping the person to the commode, perform post-procedure care. For example, report and record your observations of the urine and feces. For detailed information, see the section on follow-up care, reporting, and recording in this program.